நாங்கள் என்ன சொல்கிறோன்னா, ஒரு பிரச்சனை இருந்தால் if there is a problem it has to be solved. And ஏஜோட நம்பரை வச்சுட்டு நம்ம இல்லை you are not eligible, you cannot do surgery, you should not do surgery சொல்றது is wrong. But I would request Dr. Ponniah, who is the chief neuro anesthetist and head of neuro critical care, to tell us about the factor of age in surgery.
Good afternoon, everybody. So, as anesthesiologist, anesthesia கொடுத்தாதான் operation பண்ண முடியும். We can do the surgery only under anesthesia. So most of the time, the fear is that when we get aged, is there a risk of anesthesia? Do I qualify for fitness for anesthesia? Anesthesia related, do I get any injury or harm to my body? Do I tolerate பண்ண முடியுமா anesthesia? அந்த மாதிரி நிறைய questions இருக்கு. And most of the time these patients are refuse surgery citing age and the risk for anesthesia. இவ்வளோ ஏஜ் ஆயிடுச்சு, anesthesia தாங்க மாட்டார் அவரு அந்த மாதிரி. ஸோ அப்படி பொட்டம் பொதுவாக நம்ம சொல்லிட முடியாது. ஸோ தட்ஸ் த மெயின் ரீசன். ஏஜ் இஸ் நோ பார் அப்படிங்கிற மாதிரி. Because age is just a number. Okay. So a young patient, maybe 50s, 40s, but if he's not keeping himself well, he's morbidly obese, he's having hypertension, diabetic. But when you compare the patient who is 80 or 85, is carrying out his normal activity, who can climb a stair, is deemed to be more fit, is deemed to be more young. Age is just a number, but when you compare the fitness level and the actual physiological age, then they are more fit than the guy who is at 45 or 50 who is not keeping himself well. So with the advancement in anesthesia, so anesthesia is a very young field. With that only we are able to do a lot of modern surgeries which were deemed almost impossible in the past. But with the advancement of anesthesia, although rapid pace advancement in anesthesia has happened. So whenever for a normal patient, normally without any coexisting illness, hypertension, BP, heart disease, stent, the marila, the patient is, if somebody asks what is the risk of anesthesia, I would say you travel in a flight, so what is the risk of it getting crashed? So we don't even ask the pilot, we enjoy the journey. So that is how it has become anesthesia. So it has become so safe that has helped the surgeons, that helped the medical fraternity to do a lot of procedures and ultimately relieving the suffering of the patients. So citing anesthesia alone because the patient is of age, old age, 85, 90, refusing surgery at this era is not an acceptable thing. What they need is special attention, a special care, an extra care for their age. So that if you can take care of, then anesthesia can be safely provided and they can safely come out of anesthesia. Of course, there are certain age-specific risk factors which is involved. It's not that நம்ம கண்ணை மூடிட்டு கொடுத்துக்கலாம் அப்படின்னு சொல்றது. There are certain age-specific risk factors that we have to aware of that. We have to explain the family and we need to take care of that. Unfortunately, if something happens, there are ways to handle that also. That's not serious things. But because of that, if a patient has to suffer, நம்ம anesthesia கொடுக்க முடியாது, இவங்க high risk, நம்ம ஃபிட்டா இருக்கிற யங் பேஷண்ட் மட்டும் தான் நம்ம கொடுக்கணும், then we're not doing our job. So the awareness and the message which I want to give is age alone is not a bar to anesthesia. Age is just a number. அந்த நம்பர் அவங்களுக்கு புரிஞ்சுக்கிட்டு நம்ம அனஸ்தெசிஸ்ட் வந்து கான்ஃபிடன்ஸாக பேஷண்ட் கிட்ட சொன்னால் தான் they will get the confidence to undergo such major procedure. நம்ம ரொம்ப பயமுறுத்தி விட்டோம், தேவையில்லாத பயத்தை அவங்க மனசுல உதிச்சிட்டோம்னா not only the patient, the family, everybody will suffer and ultimately we will not be able to, even if the surgeon want to operate, they will not be able to give the result to the patient and ultimately relieve the suffering of the patient. So anesthesia in this era, in this century is deemed very, very safe, like I told you, because of the technical advancement, because of the medicines which we have got, which rapidly goes away from the blood. So immediately patient comes to consciousness, they can talk, they can be made to walk, they can start eating, may not wait for a prolonged recovery. So with all these gifts given to us and with the facilities and with the infrastructure, with the expertise, we need to try to give the maximum benefit to the patient to relieve the suffering.